Hello guys, it's Dr. K here, and today I will be talking about pain in this specific area that I have drawn here. And if this pain goes down to your testes or your genitalia, then you should watch this video. Most of the time, people who have pain in this specific area and they go to doctor, the doctor mainly checks the bladder because there are no other symptoms. You just tell the doctor that I have pain here, and sometimes your pain goes down, or you have like some related symptoms to your urinary system, like you have burning micturition, it's burning urination, or its frequency changes. So then you watch videos online, or you do Google or whatever, and then or you get diagnosed with interstitial cystitis. I think you should watch this video first because I think it's very important for you, because I have watched videos about interstitial cystitis, and many comments say that they are really in pain. People are in pain because there is literally no medication. There are medication to handle the pain for interstitial cystitis, but it also affects the quality of life. So I wanted to make a video that before jumping to the conclusion of interstitial cystitis, even if your doctor have diagnosed it for you, you should try what I'm about to tell you. Okay, so here in this area there is bladder. There's whenever a patient presents to a doctor pain specifically in this area, there are many differentials mean there are other possibilities, but mainly we consider there is probably issue with bladder. If also patient is also saying that the pain goes downward, or there is a problem with urination. So what is the other major diagnosis that you should consider if you have pain here? That is IBS. And this diagnosis will be confirmed if your pain reacts to, if you use toilet and defecate, then if there is any change in this pain, or you feel a little bit of change, it increases or decreases, then it surely is related to your gut. Okay, specifically sigmoid colon. Okay, so before jumping to interstitial cystitis and losing all hope that there is no cure or anything, you should consider IBS first. And if it's reacting to the food, like you watch videos on YouTube that some people say, oh, they start change the food, they are drinking this, eating that, and it has changed their life, then I think in 80 to 90% it is IBS. It is not interstitial cystitis. You shouldn't worry about, like, okay, you have got a disease for life that there is no cure. So if it is reacting to the food and gut, then it is reacting to your defecation, or it's reacting to when you use bathroom, then it sure has to be IBS. So for this so now, how to confirm that you don't have interstitial cystitis and IBS? As I said before, that if you have urinary symptoms, you should still consider IBS because of the location of sigmoid colon here, which can pressure the bladder and might cause the symptoms. But if the pain, if you feel someday there is no pain, or if the pain starts here instead of constantly being here, then of course it's 100% IBS. It's not interstitial cystitis. But if it is constantly in this area, then it's still okay, and you should still try to find the other causes, like if your age is above 50 or 60, then there is also you can consider a relationship with the gut. Of course, I'm not using medical terminology, so you can understand it better, like diverticulitis or diverticuli. You can have a diverticulitis if your age is above 60, maybe 50, then you should also consider diverticulitis. here I can write it for you. So how can you check confirm your IBS? If you can watch videos online, they will tell you that if you eat this food, there's interstitial cystitis just goes away, and if they start eating back specific foods, it come back. So it does tell that it is just related to your gut. It's not related to your bladder, because bladder shouldn't react to the specific foods, because if it reacted it is reactive to specific foods, then we can just prescribe you the medicine, but there is we haven't found the cure for this yet, and you can take just painkillers for this. So let's get back to the food. So if it reacts to the food, then you should talk to your doctor that it is reacting to the food, and could it be my IBS? And for IBS, of course, there is treatment you need to just take. I will put the treatment in the description, the proper treatment. If your doctor doesn't agree, you can your doctor should agree with this if you explain it to him that this but you can still try it on your own, because I think considering interstitial cystitis for just pain and urinary symptoms, sometimes people even have cystoscopy and everything, they can't find anything. If you can't find anything, and then you should consider IBS. IBS have two types. One is diarrhea, and one is C, constipation. It causes constipation. So if this sometimes you don't see constipation, sometimes you just feel normal, everything is normal, but you have pain here. So before jumping to any conclusion, please if you have any questions, write down below, and consider this differential. First, this might save you from your lifetime of suffering and psychological pain, because I was reading the comments, so I thought maybe I needed to make this video on this topic, so it might save a lot of people from the pain. You can check online what foods to eat, what foods not to eat in IBS, and you can just after 2 days 3 days you will know, after avoiding that specific food, and you will know that the pain goes down a little bit. Then you will easily can diagnose yourself that it is actually IBS, inflammatory bowel syndrome. You can just I think I don't need to write it down, but I will anyway if you want to search it online for yourself. So even if you write anywhere IBS, you can find it. So before jumping to getting scared that, oh, you have interstitial cystitis, and when people are talking about YouTube and online you write it and ChatGPT or whatever it tells you, consider IBS, especially if you are a sensitive person, and if your job is stressful, or even if you're young and your job is stressful, then you should consider this diagnosis. Why I know about this disease, it doesn't mean I get a lot of patients. I have never seen any patient about interstitial cystitis. That's why I was confused, because I myself got pain in just this area. So I was like, what are the ways to diagnose interstitial cystitis? And there were no diagnostic tests like to confirm 100% it's this. So of course it took me like maybe 5 months, 6 months to understand what actually is going on. And of course, like you guys, I was also worried, like, okay, now I have a disease for a life, because how can I cure this? There is no cure. Some people say, okay, you need to avoid this food, avoid this food, avoid this food, and do this, do that. And I was like, okay, but it like medically it didn't make any sense. So I dig deep, and then when I understand everything, so I thought I need to make a video, because I hear a lot of people are in pain. And so I will just put the treatment down in the description. You can check it out, and you can go and discuss with your doctors if you have all these symptoms like I have described, and you can dig more deep into IBS, talk to ChatGPT, like what other symptoms I have. You can talk to him and ask him to discuss neutrally, and then maybe you can find that you have IBS actually, because Interstitial cystitis, it doesn't make any sense, especially its pathology, pathophysiology. Maybe some patients have, but from the comments, the people are saying, oh, this, but it is, I think, most of the people, like maybe 90% of the patients who are discussing and commenting that, okay, they have this and they are reactive to the food, and then they must have IBS. There is treatment for IBS, which I will put in the description. I will also make video if people have pain here in this area next after taking food, and discuss what common causes are there are if you have pain in this area. Now this area is dependent on the age, so of course we need to consider the age, and here it's also dependent on the age. If your age is more than 60, then you should go to doctor, go see a doctor, not just watch online videos. But if you're younger than 60 or 50, then I think you should consider IBS. Thank you for watching the video, and if you have any question, please put the comment section. Maybe I'm able to help you, and please try to share this video so more and more people can get advantage of this video, because a lot of people are in pain and I couldn't see that, so I needed to do research on this, and make a video on this to tell that there are many other possibilities, because I'm also a doctor, so I know the limitations of every doctor. So please try to share this video, and if you have any question, please let me know. Thank you. Bye bye.